The mission of the Society really is to provide advocacy and support for patients who are facing end-of-life circumstances. We advocate for them, we provide support in all the ways that we can, and we do that wherever they are, whether they're at home, whether they're in the hospital, long-term care. Some patients are in on-call, some are in our hospice. So we try to provide that support wherever people are and whenever they need it. We have a really wonderful thing going on in our region in that there's a truly exemplary partnership that exists between our volunteer society and Nova Scotia Health. And this partnership has existed for decades. We're in our 4th decade, really. And so if you look at kind of what we do with our service partners, the service people include the physicians, the nurses, social workers, sort of the NSH health team that provide the hands-on front-end care. Our job as the Society is to support that health team in every way we can, to surround them as well as our patients and families with care. So for an example, we provide beautiful environments and nicer surroundings than a hospital can provide. We sometimes provide equipment that may not be available otherwise. We provide music therapy. We support a robust volunteer program. And those volunteers who are supported by NSH with a volunteer coordinator, they do everything from bake cookies to mow lawns to sometimes sit with people that might not have family to sit with them. There is we call it our circle of caring, and both NSH and the Society is plugged into that. We work really well together to support each other in that, and I think it works really, really well. We never really know when we're going to face life-limiting illness or when anybody in our family is going to be in that circumstances. Sometimes you can plan for it, sometimes that you can't. Also, people have different care plans and wishes for themselves. Some people, for example, have large extended families, really want to be able to die at home with the support of their families, and that works fine for those. There are other individuals who may not have those resources, may not have family, and so on. So everybody's life is very individual, and needs at that time of life are individual. And so that's why it's important to both respect the patient wishes, the needs of the family, and provide the support for the context that surrounds those individuals at that time. The Hospice Society supports the best of end-of-life care, and it's really part of a healthy, compassionate community. We're not shooting for mediocre here. We want the very best of end-of-life care, the best support for families. So I think it's part of that journey of life, but it also supports a healthy community. It helps families heal afterwards. It's definitely a circle of life and the circle of care. So it speaks to the health of our communities, I think, the work that our society does, because even though it supports the end of life, it's very much about supporting the living at whatever part of life they are.